Hello. Thank you for coming in today. My name is Dr. Badman, and I will be performing your cranial nerve examination. So it looks like you've been with us before, but not in a while. Oh my. Oh, you have had quite a number of cranial nerve examinations performed, a staggering amount, just in the past couple of weeks. That's really something. Do you have a recurring sort of issue, or just regular? Okay, all right, yeah. So we'll do a regular, sort of checkup for you. We can do that, yeah. But I just want to take a minute here to make sure that the information that we have is all up to date here. So, can I get your address? Has that changed at all? Okay. Is that 2? Yes. Okay, 2 E's. That's what I figured. All right. And your phone number change at all? You got a telephone? Got the old ring-a-ding? Yeah. Okay. Cool. And do you have a house phone number? Do you have a landline? Do you have the old POTS connection? The old dog and bone? No. Okay. Okay. All right, cool, whatever, right. Got all that. Yeah. No, I'll put that in the system later. It's just like if I do it now, it takes a while. It's kind of annoying, so. Oh. All right, 4 p.m. You're my last patient of the day, so let's go ahead and get cracking here. If you're gonna cough, just cover your mouth or something, actually. Hope you don't mind. I'm just gonna, it's 4 p.m. Take a load off, because we'll be finished in a minute, so I'm not really concerned about it. Oh, that's good. No, let's go ahead. Let's get started, yeah. Yeah, let me go mask up here, yep. Oh, goodness. I'm all out of sorts. Sanitize. Squirt. Yeah, that's okay. I washed my hands this morning, so I'm good. The secret to keeping your hands clean, because everybody goes to the bathroom, right? Well, it's a guy, right? You go do number 1, and you put your hands on your stuff, right? And then your hands are dirty. So, a life pro tip for you. You can, if the sink is low enough, you can actually wash in the sink. That way you don't have to wash every single time you go to the bathroom. So I like to take advantage of the loophole, and so I keep my hands clean all the time. It's pretty great. Let me go ahead and we'll mask up here, yeah. For my safety and yours. Give me just a moment, and we will get started here. I just want to make sure that I can do this properly. Okay. Just give me a second here. Okay. Okay, great. Yeah. Just so I can, you know. Ah, it's much better. Okay. Good stuff. Yeah. Yeah, see, you do this so I can still enjoy my beverage whilst also enjoying the protective benefits of the mask. Are you alright there? Do you need some water? You're coughing a lot. You're coughing a lot. You should just try and cover your mouth if you can. Yeah. Yeah. You seem like you need some water or something. Oh no, I can't legally allow you any water here because I don't have a permit to like provide you water. You know, you could come back and, you know, say you got salmonella from the water or something and sue us. So I can't offer you any water, but I'm gonna have to ask you to stop coughing. Okay, you really need to get that under control. But we'll go through the rest of the exam and you know, if we're able to determine, you know, why that might be, then that'll be good. So anyway, let's go ahead and we'll get started here then. First things first, we're going to check out your eyeballs, okay? I'm going to show you a Snellen chart and an Ishihara. Let me just give me a moment. I need to grab them. Just a moment here. Okay, let's see. I think this'll do here. Let me just so I'm going to show you a Snellen chart here, and that's going to allow us to determine, you know, how bad or good your eyesight is. Okay. Okay. All right. So we've got our Snellen chart here. And you should be able to make out some of the letters. So if you can, I just want you to start with the very first letter. The very first letter there. Can you read that? Can you make it out? E, good, okay. And can you go to the second line? Can you read that second line? Yeah. F. P. Mm-hmm. Can you read any more than that? It looks like you're having some trouble with that. Yeah? Okay. Yeah, it doesn't, yeah. That's a normal size for a Snellen chart. So if you're having issues, if you can't read this line here, can you read that? No? Okay, well, you're probably blind. That's going to make you legally blind if you can't read that. That's a standard Snellen chart. Yeah. So if you can't, that's going to be a problem. You're going to want to go to your eye doctor about that, probably. Get that checked out, okay? Yeah. I'm going to ask you again if you could just cover your mouth when you cough, okay? Because you're coughing up a storm, and I don't want to get whatever it is that you clearly got, okay? You know, I mean, the masks are to protect, you know, you and me, okay? I mean, for whatever reason you just have decided to come in without one, which is, you know, maybe says something about how we're running our establishment here as well. Hard to say. Anyway, so next up I'm going to show you an Ishihara, and basically this is a colorblind test. And the chart I'm going to show you here has a number of dots and patterns and stuff. And so when I show you this, you should be able to make out the number. And there is a number hidden in this, and you'll be able to see it because you differentiate the colors. So this is the Ishihara. Can you see the number there? Can you? Yeah, I can bring this one closer because it's not the the other chart we were just looking at. So you should be able to see. You should be able to see the number. Can you see the number there? Can you see it? You should be able to make out the number. I can see the number. Yeah, I can see the number fine. You can't make that out? Okay, well, you're colorblind. I know this has got to be pretty rough, especially seeing as you've had 30 cranial nerve exams in the past week. But, we try to be really thorough here. And I can tell you right now, if you can't make out the number in here, you're blind. You are blind as a bat. The number? Yeah, no, it's 8. The number is 8. Yeah, no, I can't show it to you again because that would invalidate the efficacy of the Ishihara. So I can't show you that again. Next, we'll go ahead and test how bad your eyes, truly are. We're going to do what is medically known as the 4-quadrant wiggle, and I'm gonna take my 2 fingers, okay, both of them, and I'm gonna move them in either quadrant of your eyes, and I just want you to tell me if you can see it wiggling. Okay, right? Okay. 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 And I'm gonna introduce 2 here, and I want you to tell me. Just let's say left or right is fine, if you can. Okay. All right. Okay. Okay. Good. All right. Great. Good stuff. Give me a second here. Let's see. Snellen chart status. Blind. Ishihara. Blind. 4-quadrant wiggle. Okay. All right. Great. So next here, I'm gonna flash this light in your eyeballs. Okay, is it alright if I get this close to you? Please don't cough. If you cough at this distance, with the modifications that I've made to my mask, I will probably die. Okay, so I'm gonna go ahead, and we're going to check your eyeballs. If you can hold your hand just right up here, just to the bridge of your nose. I'm just gonna see about your eyeballs there. Make sure they're doing fine. Yeah, I could explain to you what I'm looking for, but it's very doctory stuff. I'd have to use some really big words, and I frankly do not want to confuse you or anything. Yeah, no, this is normal, so I'm going to go ahead and check your other side here. Okay, and I want you to just give me a good blink. I want you to blink like blink, 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 blink. Okay? Okay, cool. Yeah. No, like I said, I could explain it to you, but it's very doctory. It's big words, and it's very big words. It'd take a minute I'd have to explain to you like 6 years of schooling and all that, so. Oh, yeah, okay. I was like, get home and crack open a cold one with the boys. Why do you have to wait till you get home? Why does it have to be with the boys? Crack open a cold one with the patient, I don't have a cold one here for you, which is why it's, but, you get the idea. You can live vicariously through me. I don't know if you could drink anything with the way you're coughing. Yeah. You want like you need some tea or something. I can't make you any tea, like I said, because I don't have a permit to do that, though, so. Okay, side-by-side visual test is okay. Now I'm gonna just take a closer look at those little footballs, right? take a look. We'll take a look at those little things you call eyes that are just not doing too well for you. You okay? All right, I'm just gonna check your eyeballs here. Okay. I'm just gonna get a little close. Pardon my Philly cheesesteak breath. I had some nice onions on there, and so if you're smelling my sandwich breath there, that's what it's gonna be. So I'm looking at your left eyeball here. I just want you to look to the sky, look up. Okay, and look down. And if you can I want you to look the other way. Good. Okay, great. All right, good. That's great. Mm-hmm. Yeah. Look to the east. Look to the east. At dawn. All right. We'll check your other eyeball here. Mm-hmm. I want you to look up and look down and look to the left. Now I want you to look to the right. Yep, they are bad. Those are some bad eyes you got there. Now, I've seen a couple eyes before, but I'm going to tell you right now, I've never seen eyes as bad as your eyes. Probably shouldn't even be allowed outside. You could, but yeah, you're a real danger. You're a danger to society with eyeballs like that, I'll tell you what. All right, magnifying glass test for your eyes. Bad, okay? I don't know what all these other doctors are doing, but you gotta get these things checked out, okay? You gotta get them nicely checked out. I'm gonna replace going there with a melon ball and scoop those things out of there. Worthless. How did you get here? Did you drop? Okay. Anyway. Okay. So next here, I'm just gonna have you follow my finger here. Okay, I'm gonna start over here, and I just want you to follow my thingy wingy. Now don't shake your head around. I just want you to use your eyes. Excuse me, if you just. Do you need water? You really got to get that cough under control. Okay. Do you need a minute? Okay. All right. I'll give you a second. I'm gonna make sure I haven't missed anything here. Do your face muscles and some face stuff right now. Okay. You ready to go? Okay. Good. Right. So we'll start this over again here. My apologies if you hear shouting. There's a daycare center next door, and they got lots of little COVID kids running around. So I want you to follow my finger here, and I'm just gonna keep that going. Okay, very good. You're looking bad there because your eyes are bad. Okay, very good. Okay, that's great. Now we're gonna kick it up a notch. Okay, we're gonna kick it up a notch. Okay, so I'm gonna do this again, but we're gonna go fast mode. Okay, so I want you to make sure you don't move your head. Okay, good. You're great. No, I mean, you're bad. Your eyes are so bad. They're so bad. Anyway, make a mark of that. Well, it looks like you lost my finger a couple of times, so I'm going to give you a C-, which is still passing, to be clear, so, don't feel too bad about it. Okay, next we're going to do, well, here you go. I'll tell you what. Yeah. We'll go ahead and do a soft, sharp test, right? Just want to check and see if your parts of your face are able to determine that which is soft and that which is sharp, okay? So we'll take sharp, and then I'm going to touch your face with a sharp object or a pointy object. And then I'm also going to touch your face with a soft object. Okay, now close your eyes. All right, your eyes closed. How many fingers am I holding up? Okay, good. Eyes are closed. Good, great. Keep them closed. Yep, keep them closed. I want you to tell me if you're feeling a soft object or a sharp object, okay? Okay. Yep. All right. Okay. 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 Good. Very good. Keep your eyes closed. Eyes closed. Keep them closed. Okay, great. Okay, you can open your eyes now. Okay, good. Yeah, you did good there. Yeah, the face parts are working. That's good. Okay. Get an okay. If I had a gold star to give to you for that one, I'd give you one. But I don't have any gold stars because this isn't a daycare center. So, let's see. Do your face muscles, and I'll hit you with the tuning fork. And I know I'm forgetting something. I mean, I'm not forgetting anything. I'm just waiting until later. So, let's see. Next thing I'm gonna have you do is I'm gonna put my hand here on the side of your face. I just want you to turn towards it, and I'm gonna hold. Okay, good. Right. And on this other side here. Okay, good. And I'm gonna try and keep your chin up. I'm gonna keep your mouth closed. I want you to open it against the force of my hand. Good. And then I'm gonna check your shoulders here. So I want you to just give me a good shrug. Okay, good, great. You're fine there. And I want you to wrinkle your forehead like you're trying to wrinkle your forehead. Okay. And next we're gonna have you return to monkey. So I want you to okay, and show me your teeth. Okay. Okay, very good, great, cool. So your face parts are working. There's something I'm not. Oh yes, right. Tuning fork, and then smell and taste. Smell it. You okay? Yeah. Yeah, that's a real cough you got there. You should probably get that checked out. Go to a doctor. Oh yeah, no, I'm a doctor. I just can't. I can't help you with that. So next we'll do the tuning fork. I'm gonna place this behind your ear, and I want to make sure you can hear it. I'm gonna place it next to your ear. I'll do the same thing on the other side, and then I'll give you a little bap on the noggin. We'll make sure that you can hear this evenly on both sides. Okay. Okay. All right. So let's get started here. Go around the back. Can you hear that? Okay. Okay. And I'm just gonna come on the other side for you. This side. Sounds good. Great. Okay. Now, come at your right side here. Let me know when you can't hear that anymore. Let me strike it again. Okay. I'll get your other side here. And let me know when you can't hear that. Okay, great. Cool. Now I'm gonna come up here and we'll give the old noggin a good strike there. Okay, very good. Yeah. Yeah, I can see your little, yeah. No, I didn't hit you hard or scrape you or anything. It's just you don't floss. That's why you're bleeding up there on your, where we hit you with the fork, because you don't. Yeah. Yeah, if you don't floss, it can lead to bleeding everywhere, even outside of the mouth. Mm-hmm. Yeah. You know, that's something you'd only learn from a doctor, like myself. Oh yeah, I've been doctoring for about 2 months. Mm-hmm. Mm-hmm. Yeah, I got my degree from BMS. It's very highly rated. You can actually just go straight to their website and print out the PhD, and it's pretty great. It makes it very easy for, you know, people like myself who are passionate about patient care to you know, to really just get in the field and start taking care of patients. And that's what I love to do. So for this next part here, I'm just going to whisper a couple of phrases or sentences into your ears, and I just want you to repeat back to me exactly what it is that you hear. Okay? All right. I am a danger to society. I am a danger to society. I am legally blind. I am legally blind. I drove here whilst not being able to see. I drove here whilst not being able to see. Okay. All right, very good. Yeah. Now these are completely standardized. So if you go anywhere, I'm sure they've said this to you before. All right? Okay. It's a miracle I have not killed anyone. It's a miracle I have not killed anyone. Okay. Okay, good, great. I should be locked up in a cell. I should be locked up in a cell. All right. Okay, very good. Anyway, we'll go on to your oil, the old factory nerve. So, let's go ahead and proceed now with that. So, we'll start with some common smells that you should be able to identify, okay? All right? I want you to tell me what you're smelling there. Very common smell. Should be able to identify that. No, that's not right. No, that's that's cinnamon. That is cinnamon. So okay. And what did it smell like? It nothing. Didn't smell like anything. Okay, that's a pretty strong one. Next one up here. Why don't you give that a smell for me? Very common smell, should be easily identifiable. Still nothing? Okay. Yeah, that's odd. Yeah, well, if anyone asks you, that's cumin. That's ground cumin. Very popular spice, to my knowledge. Yeah, ground cumin. You can't. Okay, so anyway, we'll move on to the next thing. All right, this one. Now this is a common smell. Okay, if you can't identify this, well, if you can identify the next one, then we'll really have a problem. So, why don't you give that a smell for me? It's a liquid. Nothing. Okay. That's a very common smell. I don't think I've ever had anyone not be able to identify that before. That is AutoZone brake fluid. So if you're not able to identify that, it's concerning. You should go to your nose doctor. They'll be able to tell you all about the olfactory nerve. Last thing here. Will you smell that for me? This is another liquid. Pretty strong. Should be able to tell what that is. Nothing? You get absolutely nothing from that. That's isopropyl alcohol, okay? If you're not smelling that, I don't know what the problem is. Okay, great. So, anyway, let's move right along here, yeah? Taste test now. Mm-hmm. Oh yes, tasty, taste. Okay. Good. Okay, so I've got a couple of taste sticks here, and I just want you to tell me what they taste like. Okay, very recognizable, very easy stuff. Right. I want you to give that a good taste and let me know what it is you taste there, okay? Nothing. That would be sour apple. You're not tasting anything with that? Unless I labeled them wrong. No, that is sour apple. Okay. Next one. I want you to taste that for me. Nothing? Yeah, it should be orange. So you should have tasted orange just then. Yeah, it's orange. You're, oh goodness. You okay there? That's another coughing fit. You need like a Ricola or something, eh? Yeah, like I said, I don't have him here, and even if I did, I couldn't give him to you because you could get salmonella and then sue us, and I don't want that. So anyway, let's move right along. Once you're finished coughing. Yep, finish hacking it up. You good? You ready to go? Okay. All right. Last one here. It's going to be peppermint. Oh, I just told you what it was. Can you taste peppermint? You should be able to taste that. You're tasting pepper. Okay, well, is that just because I told you what it was by accident? Is that it? Because thus far you've not been able to taste any of them. And I can tell you right now that that's peppermint. That is peppermint. Okay, so, I'm going to tell you right now, you didn't pass, okay? Between you being completely blind. Oh, you know what? Yeah. Between you being completely blind, and I don't know how you got here. That's very concerning to me. Do you have someone? Did someone drive you here, or did you drive yourself? Do you need someone to drive you home? Because you can't see. You drove here. Okay. All right. Well, that's a problem. Anyway, we'll go through the rest of this. Face muscles and jaw, everything was good. Your eyes are fine. Your eyes are bad, but your face is okay. You can hear, and you're not able to, you couldn't smell or taste anything. So you couldn't smell or taste. You're not, do you have COVID? You COVID positive? Oh my. Okay. Okay. Oh my god. Oh, I licked the popsicle sticks. Oh, shit. Oh, okay, 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 okay. We're fine, we're fine, we're fine. You know, alcohol kills the virus. Alcohol kills the virus, so I'll just. Okay, alright, alright. And I'll be okay. Okay. Okay, alright, well. Okay. Yeah. Mm-hmm. Yeah, you need to go. You need to get out of here, okay? Alright? I don't care how you get out. I just need you to go, okay? Okay, great, cool. Yeah, I'll see you. No, don't come back here. No, I won't see you next time, okay? I have to leave. It's Friday. I will catch you around, okay? Alright, bye. Scoot.